So what are the symptoms of depression? We can remember it with the mnemonic. So, again in the books, you may get this mnemonic SIGE CAPS. So what we have done is we have added certain modifications we have done so that we can cover all these symptoms of depression. So the mnemonic you should remember is SIGE CAPS, CAPS with a double S. So let us try to understand what are the symptoms. So the first symptom, S, of course, it's a mood disorder. So S is the mood. S is sad or depressed mood. So here the patient has a persistent and pervasive sadness. So most of the time, most of the places, the person will feel sad or depressed. So this is again a very important core symptom of depression. In children at times, you may not get clear-cut depression or sadness. There may be more of irritability. The mood will be irritable. That means the child is getting angry unnecessarily without any reason or on very, very small reasons. So they may be more irritable than sad. So again, one should be careful when we are seeing across the age group and we're trying to see depression. Then I, again an important symptom, I is interest. So there is a decrease in interest, and in fact that is known as anhedonia. And again, there is a decrease in interest in pleasurable activities. The person would not enjoy things which he or she would enjoy before. And again, family members also, or the people around living around the person may also start noticing that there is a withdrawal, there is a social withdrawal, or there is a neglect of these pleasurable activities. So there is anhedonia or decreased interest. So this is again important. Then next is G. G is feelings of guilt or worthlessness. So there is again, the patient has excessive and at times these are inappropriate guilt. Sometimes they may be up to a delusional level. The person may think that I'm a very bad person, or I'm good for nothing, I'm worth nothing, and sometimes they may believe, they may start having thoughts like they are a sinner. So sometimes they may be at a delusional level also, and they often misinterpret the neutral stimulus as evidence of some personal defects. So for example, a person with depression goes to office and he sees that his colleague who used to sit next to him has taken a leave. So it may be because of so many reasons, but the person may start thinking that because he does not like me, and maybe he is not willing to sit in front of me, so that is why he's avoiding me. So such types of excessive guilts or feelings of worthlessness, so they may interpret these neutral stimulus also at times that there is something defect in me. So this is G. Next is E, energy. So there is a decrease in energy, or there is easy fatigability. These patients get tired very easily. Now please remember, it is seen in almost all the patients with depression. So nearly 97% of the patients complain of decreased energy. So again, if someone asks you again, these are important points, suppose you're asked in an MCQ. So this is again nearly seen all the patients with depression. So again, an important symptom. Now again, they have difficulty in their task. Also there is decreased motivation to do new task. So even this may be very severe at times. Even the smaller task of dressing, of washing, even those tasks, the person may feel that he has to make a lot of attempt. So these patients with depression, they get tired very easily. Sometimes they say even I'm just sitting, I get tired, or I do just small amount of work and get tired easily. So there is decreased energy or easy fatigability. This is SIGE. These are the 4 symptoms in SIGE. Let's discuss other symptoms. C is concentration. There is, again, we have talked about in the disturbances in depression. Again, there is decrease in concentration, and the patient may present with symptoms of forgetfulness, that I'm forgetting things, I'm forgetting important documents where I kept the keys, I forget. In between a conversation, I forget what I was talking about. So these symptoms a patient may present to us. But please, again, as we had discussed, please remember that this is not the memory loss, but this is because of decrease in concentration, so often known as pseudo dementia, which we had discussed. So there is decrease in the concentration. Now next, A is appetite. Again, we've talked about in the vegetative symptoms, there is, again, both can occur. There may be more often there is a decrease in appetite, and subsequently there is a decrease in weight, significant weight change. So generally what we call significant weight change when it is more than 5% in a month. So there is, again, decrease in appetite, and subsequently there is a weight loss. But some patients may also report of increase in appetite, and so they are eating more than usual. At times a lot of carbohydrate craving may be there, and subsequently there is a increased weight. So this is another important symptom. The next is psychomotor retardation, and there may also be agitation. So the psychomotor activity, so there is a disturbance in the psychomotor activity. Now psychomotor retardation, again, these are less common, but if they are present, they indicate, if they are present, they indicate that there is more severity. So it would suggest that, usually, again, if you're able to notice psychomotor retardation, it would suggest that maybe the symptoms are more severe. And again, agitation again can be seen. And again, agitation, the person is restless, he's unable to sit, he's pacing around. So that may be seen. So retardation is when there is slow thinking, there is, the speech may be low, and even the body activity is low. While in agitation, the person is very agitated, restless, he's not sitting at one place. So these can be seen. More, again, commonly psychomotor retardation would be seen. And if psychomotor retardation is seen, then it is suggesting of more severity. Then let's talk about the next symptom. Again, very, very important symptom. We have discussed this. Suicidal thoughts or acts may occur. Again, these may be, from passive death wishes, to maybe as severe as the person is planning or intending, to attempt suicide. So again, these may be present, and one should be very careful. If a person having, active, suicidal thoughts or attempts, again, one should take those things seriously. So this is S. And the next S is again another important vegetative symptom. There is disturbance in the sleep. And in fact, it is seen in nearly 80% of the patients, with depression. They complain of some sort of trouble in their sleep. And again, as we discussed, this problem there can be insomnia, that is decreased sleep, and there can be hypersomnia. So there may be decreased sleep or insomnia. Again, we know insomnia is divided into initial insomnia, middle insomnia, and terminal insomnia. So again, characteristically, many of the patients may present with early morning insomnia, that is terminal insomnia. So they may report of waking up at least 2 hours. At least 2 hours before their usual time. So patient may say that I wake up, 2 hours before my usual time. So there is early morning insomnia. Even, again, there may be in between, there may be a lot of awakening. So middle insomnia, and sometimes patient may have initial insomnia also. And some patients may report of excessive, sleeping. Even in the daytime, they may report the time sleeping. So there may be hypersomnia as well. So these are the symptoms which we see in depression. So we talked about, what are all the disturbances and what are the symptoms we include in the diagnostic criteria.